The cardiac cycle represents the set of the phases of contraction, systole, and relaxation, diastole, that follow each other in a 0.8-second time period. The cardiac cycle includes 4 phases.
The first phase is the atrial diastole, which lasts 0.4 seconds. When the atria are relaxed, they fill with blood coming respectively from the veni cava, the right atrium, and from the 4 pulmonary veins, the left atrium, isovolumetric filling.
When the pressure in the atrium increases, the opening of the atrioventricular valves occurs. The tricuspid valve opens between the right atrium and the right ventricle, and the bicuspid or mitral valve opens between the left atrium and the left ventricle, isovolumetric filling.
With the opening of the valves, the blood spontaneously flows into the ventricles. Immediately after, atrial systole occurs, 0.1 seconds, during which the atria contract and are completely emptied.
The flow of blood into the ventricles causes their progressive filling with blood and their increase in volume, with the consequent increase of pressure inside the ventricles, isovolumetric filling or ventricular diastole, 0.4 seconds.
With the filling of the ventricles, the pressure inside them increases compared to the pressure inside the atria, causing the snap closure of the atrioventricular valves. This is the first sound of the heartbeat. Ventricular systole starts, 0.3 seconds, determining a further increase of the pressure inside the ventricles, which causes the opening of the semilunar valves, the aortic valve between the left ventricle and the aortic artery, and the pulmonary valve between the right ventricle and the pulmonary artery. Blood forcibly flows into the aorta and into the pulmonary artery. The pressure inside the ventricles quickly falls, with respect to the pressure inside the aorta and the pulmonary artery. Therefore, there is the snap closure of the semilunar valves. This action produces the second sound of the heartbeat.
The cycle begins with the ventricular diastole, 0.4 seconds, in which the relaxed ventricles start filling with blood once again. It's important to understand that ventricular diastole occurs while atrial systole is happening, and vice versa, ventricular systole occurs while atrial diastole is happening, or rather they happen at the same time. We can see this in the animation of the complete cycle.